Good afternoon, everyone, and welcome to LGBTIQ plus Health Australia's Policy and Research webinar, which today will feature representatives from the Australian Bureau of Statistics, describing the estimates and characteristics of the LGBTIQ plus populations in Australia. We'll just give it a couple of minutes to allow a few more people to join. But actually, I think because I have seen the slides and I know that there's a lot to cover, I wonder if we might just proceed. There will be a recording available for anyone who does join late. All right, so let's get underway. Good afternoon again. Welcome to our Policy and Research webinar. Today we have Elise and Nicole from the Australian Bureau of Statistics to give a presentation titled See Yourself in Data, Estimates and Characteristics of LGBTIQ plus Populations in Australia. My name is Ian Down. I'm the Policy and Research Lead at LHA, and I use he, him pronouns. At LHA, we honour the traditional custodians of the lands across Australia. We recognise the rich diversity, histories, and enduring knowledge of First Nations peoples and their deep connection to country. Today, I'm joining from the lands of the Gadigal people of the Eora Nation, and I pay my respects to their elders, past and present, and to all Aboriginal and Torres Strait Islander people present, affirming that sovereignty was never ceded and these lands remain Aboriginal. And as we begin the webinar, I invite you to reflect on the lands and the history of the lands on which you are, and if you wish, you can share those in the chat. Before we begin, I'd just like to mention a few housekeeping items. This webinar today is being recorded and it will be available on the LHA website. So if you miss anything, you will be able to find it there and go back and listen. After the presentation, there will be an opportunity to ask questions, and I invite you to use the Q&A function, which for most people using Zoom is located down at the bottom of your screen. Please feel free to ask questions at any time, and time permitting, we will come back to them after the presentation. And finally, if anything in today's webinar raises concerns for you, support is available. You can contact QLife, which provides Australia-wide anonymous peer support for LGBTIQ plus people. QLife services are free and include both telephone and web chat support. Information can be found at qlife.org.au. Okay, so we're very fortunate today to have Elise Kennedy and Nicole Capper from the Australian Bureau of Statistics with us to talk about some work that was released in December last year, estimates and characteristics of LGBTI plus populations in Australia. So for the first time, using innovative methods, the ABS has produced its best possible estimates of the size, distribution, and characteristics of LGBTIQ plus people in Australia. And this is a huge step forward because what we measure shapes what we prioritize, and that directly impacts policy and funding decisions, which is why this work is so important. Reliable population level data is crucial in shaping funding, policy, and service delivery. It tells us where resources are needed most, and it helps ensure LGBTIQ plus people aren't left out of crucial health planning. The National Action Plan for Health and Wellbeing of LGBTIQ plus A plus people 2025 to 2023 highlights the importance of evidence-based decision-making, and the ABS's 2020 standard gives us a tool to make sure LGBTIQ plus people are counted. Without this kind of data, our work would be so much harder. I'd like to acknowledge the ABS's commitment to meaningful engagement with LGBTIQ plus people. How questions are asked and the language used are important and culturally specific. The ABS recognizes this and includes LGBTIQA plus people in the development of these questions, ensuring the data collected genuinely reflects our diversity and lead to better outcomes. So let's meet our speakers, Elise Kennedy and Nicole Capper. So Elise leads the team which brought together the LGBTI plus populations data set at the Australian Bureau of Statistics. Elise's team were responsible for building and compiling the data set for publication. Elise has a particular interest in data which will inform the public and policy makers to improve the health of all Australians. She has over 20 years experience working at the ABS with 10 of these in health research and data roles. She has also worked on topics such as housing, labour market, and education, as well as providing survey methodology advice to survey managers. Nicole leads the Sex, Gender and Family Statistics team at the ABS. In this role, Nicole champions better data and insights about LGBTIQ+ communities through the implementation of the standard for sex, gender, variations of sex characteristics, and sexual orientation. Nicole's career spans a range of social statistics, including crime and justice, census, family and household statistics, as well as working with clients on measures of housing outcomes for Aboriginal and Torres Strait Islander people and communities. So please join me in welcoming Elise and Nicole. Thank you.
Thanks, Ian. That was a lovely introduction. Really looking forward to talking to you all today. The Australian Bureau of Statistics also acknowledges the traditional owners and custodians of country throughout Australia. Today I'm on Ngunnawal land in the ACT. So I'm going to do most of the presenting today, and Nicole's here to talk as well and answer any questions. So as some background, I'm sure that you're probably all aware that we published the experimental estimates of LGBTI plus populations late last year. And as Ian mentioned, if you can move forward one slide, Nicole, this is the first time that the Bureau has published data like this, and it's the first of its kind in Australia. It's like essentially a large sample of 45,000, a large sample survey of 45,000 people, and it comes from the 4 health collections that you can see on the screen there, which were all collected around a similar period. So we took data from each of these collections for people aged 16 and over, except for the survey of disability, ageing and carers, where we only used answers from people who were 65 and over. In that collection, the questions weren't asked of everyone in the survey of disability, ageing and carers below this age. And I'll talk a little bit more about that in a few minutes. Just moving to the next slide, we're looking at, I just wanted to take us through the ABS standard for sex, gender, variations of sex characteristics and sexual orientation, which Ian mentioned before, because we used the questions from this standard in those health surveys that I just talked about. I'll try to move through them pretty quickly because I'm assuming that people will probably know about them. The first one is sex recorded at birth. And the way that we do this in population surveys is that when we knock on the door, so to speak, when we go to a household to do a survey, we ask some questions of an adult who answers the door, and that might not be the person who's actually selected within the household to answer all of the survey questions. So this is important, and I'll talk about it again in a few minutes. So if we move on to the gender question, this question and the other questions that I'm going to talk about in the standard are asked directly of the individual who is responding to the survey. We use something called a prompt card, so that the question is asked by the interviewer in an interview situation, and then we have a prompt card, and the person can say which number or which item they want to talk about. We don't ask the questions of anyone who's 14 and younger, because for those people, we actually talk to their parents. We don't talk to them directly. And it's important that these questions are asked of the person themselves. When we did these questions, the option 4 allows people to specify a different term, and the terms that they reported commonly were that they were trans or gender fluid. The next one in the standard is variations of sex characteristics, and I'll talk more about this group of people shortly. We also ask about sexual orientation. And again, some of the terms that people wrote were pansexual, asexual, and queer. So that's what some of the things that people were trying to communicate in addition to the other options on here. So we take the information about that people tell us about sex at birth, sex recorded at birth, and their gender, to create a derivation for people who are trans and gender diverse, or and that can also be known as gender experience. So if a person's reported gender is not the same as their reported sex at birth, then they would be derived to be trans. If not enough information's provided, then we would classify the person as inadequately described. I've put the matrix or the table that we used for this publication here instead of the one in the standard. And the difference there is that if somebody said that they were non-binary or a different term in their response to gender, then we have described them as being trans. And also in this data set, if a person wrote or recorded that they were trans in any of the specified responses, then we made sure that they came up in this derivation as trans. So there were 17 records that we amended. So, for example, if somebody wrote that they were a trans woman somewhere, then we ensured that her sex recorded at birth was male and her gender was female, so that she would be counted as a trans woman. I'm about to talk to you about some of the data and some of the findings that we found, but before I do, I wanted to just talk about the fact that we think that these estimates are potentially an underestimate. So they reflect how many people chose to report to our interviewers. And they might miss some people who chose not to report. And that we call that non-sampling error, but that can happen if the questions are not understood, if the information that we're asking is sensitive. So people might not want to disclose their information due to a history of discrimination, if they fear that they might be persecuted, if they're not feeling comfortable or safe at the time of the interview. For example, if somebody else is from the households in the room at the same time, if they want that information to be private, and also they might say a response that they might think is socially desirable to the interviewer. And we can't really find numbers to apply to this. All we can say is that in our data, it's the people who report. I'm just making sure that I've said everything that I need to about this. Yeah, we don't actually have a numeric number that we can put to how many people might have chosen not to report. I'll go on to the next slide, which is about acronyms. we worked really carefully with our peer reviewers around the acronyms and what names we could use to describe the what we had collected, and this has been what we've come up with. Um, we we certainly acknowledge that when we use these acronyms, they can they're a large group of people, especially the LGBTI plus one, and that they have a range of really diverse experiences. But we um, needed to use uh, something that was a bit shorter than describing longhand every single time we wanted to refer to them. We've also encouraged people to use the definitions and the acronyms as they are, and not change the letters in them when they're reporting on this information. Obviously, we don't always have control over that. So let's get to the exciting part. This is the exciting part for me, which is the actual key findings, the actual data. So we found in that there were 910,600 people who were LGBTI plus, and this is almost the combined population of the ACT and Tasmania. So it's a lot of people. That's people 16 years and over, and that's 4.5% of the population. We also have the key estimates for the other groups as well. So the lesbian, gay, bisexual, or people who use a different term for their sexual orientation was about 740,000 people. Those who are trans and gender diverse was 179,000, and people who report they were born with variations of sex characteristics is 63,000. So within our publication, which Ian has kindly put a link to in the chat, we also provide information on national estimates. We provide age breakdowns. We provide some geographical information, country of birth. We also provide whether their main language spoken at home is English or not English, and marital status. And as I've said, we think that all of these are underestimates of the true number of people in the population. So I'll go into a little bit of detail. The for the LGBTI plus, this again, this group, it counts people if they were lesbian, gay, bisexual, or used another term for their sexual orientation, if they were trans and gender diverse, including non-binary, if they reported they were born with variations of sex characteristics, any or all of these are the people that are included in this group. We chose to publish this group because it's not possible to add up the LGB plus, the trans and gender diverse, and the people who report they were born with variations of sex characteristics just on spec, because as everyone knows, there are some people who might be in 1, 2, or 3, or all of those groups. So for example, someone can be bisexual and also a trans woman, and this means she would appear in the LGB plus estimate and in the trans and gender diverse estimate, and she would be counted as an LGBTI plus person. About 1 in 10 people aged 16 to 24 in Australia, so if we go to the next slide, are LGBTI plus. Just a little note that we've on this graphic, we've put some error bars, and so these are statistical error bars, And they come about because if I was to take a different sample of 45,000 people, then I might get a slightly different estimate. They don't reflect the non-sampling error, for example, where people don't disclose because of fear of discrimination. So you can see that in terms of people reporting, younger people were more likely to report. So if we go to the next slide, this shows us state and territory. And we can see that the proportion of people who report being LGBTI plus in Victoria, say, is higher than New South Wales, Queensland, South Australia, and Western Australia. So that's just what comes up in this information, in this data. So if I go to the next slide, which is about the LGB plus, so that's people who are lesbian, gay, bisexual, or use a different term to describe their sexual orientation. Those are the summary numbers that we've talked about before. And if we go to the next slide, it shows that for people aged 20 to 24, 1 in 10 report being LGB plus in terms of their sexual orientation, and they are more likely to report an LGB plus sexual orientation than any other age group. This slide shows that the most commonly reported sexual orientation was bisexual. So 1.7% of people in Australia report being bisexual, people aged 16 and over. As I mentioned before, the one on the right, which is a different term, some of the common terms that people wrote were asexual, pansexual, and queer. We also have some information about people who are LGB plus. So we can see the proportions who are married or in a de facto relationship. And we can also see some of the geographical information there. I'll let you read those for yourselves. I can say that LGB plus men are less likely to live in outer regional and remote Australia compared to heterosexual or straight men. We have some other information about women as well in the publication, which you can look at. They're equally likely to live in each remoteness area as heterosexual women. If we go on to the next one, we have the state and territory groupings there. And again, Victoria is higher at 4.4% of their population than New Zealand, Queensland, South Australia, and Western Australia. We have one finding for, or two actually, I suppose, the proportion of people of Australians 16 years and over who report that they know they were born with variations of sex characteristics is 0.3%, and that's 63,300 Australians. It's not possible to further describe the characteristics of people who report that they know they were born with variations of sex characteristics due to the sample size of the data set, limiting the reliability of further disaggregation. We expect that the true number of people who were born with variations of sex characteristics is potentially higher than the 0.3% that we're getting here, because some people might not know that they are born with a variation of sex characteristics until they get to a point in their life, perhaps when they're trying to have a family and they find that out. And also people the next one that I want to talk about is for trans and gender diverse Australians, or their gender experience. I've already said that people did respond that they were trans, and they'd written information in saying, "Count me, I'm trans," and we checked all of those against the derivation. We've tried to show data on trans women and trans men where we can in the publication, and this was we talked about that a lot with our peer reviewers, who I'll talk about in a few minutes. Just talking about how important it is to have information, because obviously the experiences of people who are trans men, trans women, and non-binary people can be quite different. So we've tried as much as we can to put that in there. It should also be noted around these data that the person who answered the question about sex recorded at birth might have been a person who just answered the door. And so it wasn't necessarily asked directly of the person. Whereas the gender question was asked directly of the person. So that may contribute to us not having captured everyone in this in the way that we derive it. If we go on to age, so 1.8% of people in Australia aged 16 to 24 are trans and gender diverse, and 7.7% of trans and gender diverse people live in outer regional and remote Australia. So people are everywhere, is what we're trying to say, which is not surprising at all. So we also have information about marital status and English as the main language. There is data on states and territories for trans and gender diverse people in the publication, which you can look at in the if you go to the downloads tab. We also have some information about how these estimates compare to the New Zealand census. Probably the New Zealand census is the only, if you can change the slide, that'd be great. The New Zealand census is probably the only comparable data set for LGBTI plus and people born with variations of sex characteristics. And also the populations between Australia and New Zealand are relatively similar, not completely similar, obviously. So that's why we've chosen to make the comparisons. Some of you might have seen some publications around the census data, and what we've used here are numbers that are are calculated on the same basis as our experimental estimates are, in terms of the fact that they include everyone, not just people who responded to these questions. So I've got a slide in here about the differences between the experimental estimates and potentially census data when it is collected. So the census data would provide a snapshot on census night, and it would be expected to allow further insights into population demographics and socioeconomic information. The experimental estimates, they provide national population estimates of the different groups, but they are a sample survey, so they are subject to error, like to sampling error, as I've talked about before. We thought that it was really important to publish the estimates, because they're a first step towards addressing a large data gap and potentially a policy need. By doing this, we are ensuring that people are represented in ABS statistics. We're demonstrating that the data can be collected in the surveys, in survey situations. We wanted to recognise the LGBTI plus population and highlight the size of the populations who might need support and funding. Really, I mean, it shows how significant and important these populations are in a data sense, in terms of saying, valuing these populations and people, and showing that they can be seen in the data. The experimental estimates will be a source until the census data are available, and can be used for national and state and some state and territory level broad information. I also wanted to talk a bit about the consultation that we undertook. So there were a group of people who have been with us over the long term of this project. Initially, we were talking to people about how to interpret the data in health surveys, and it sort of came a little bit from that, but we've continued to speak to some of the people that we spoke to about the health survey issue, all the way through with this collection, and certainly the external, well, the consultation that has happened has meant that we included data on variations of sex characteristics. It wouldn't have happened without the consultation that we had. We were also able to refine the language and talk to people about the different experiences. I know that the team learned a great deal from talking to people with lived experience, and a range of people with lived experience, so that that could come through in the publication in the end. We also did a lot of internal consultation within the Bureau of Statistics, because there can be sort of silos in some ways, but for this one, we had a lot of input from many different people. With on the next slide, we have more information about the peer review. So this was where our colleagues outside of the ABS were able to get early access to the results and help us with determining how we would talk about them, and make sure that we communicated clearly and described the populations clearly. And we felt a strong duty of care for the community members to ensure their safety as much as we could do when we were publishing data like this. And I will note that the relationship in terms of peer review is ongoing. And when we first published, we got quick feedback from some of our peer reviewers, which was great when the media started talking about this particular publication. Overall, the media interest has been positive. We were concerned that there could be negative media coverage and that would be harmful for community members. However, to date, we haven't heard of anything like this kind of coverage. There have been some issues with loose terminology in the media, and we've tried to ensure that things would stay factual. We have received a lot of positive feedback from individuals and people saying that it did make a difference for them to see this data being published. So I think somebody said that they didn't imagine within their lifetime that they would see gender experience comparisons from the ABS. So that's really positive. In terms of what's next, there is obviously the census coming up. So there's a test in August. And then on census night on the 11th of August in 2026, that is census night. Yes, so there will be a large-scale test in August this year to test the performance of the proposed 2026 questions. It will also allow us to look at the models for enumeration, the systems behind the scenes. The test will approach a sample of households across various parts of Queensland, Victoria, Western Australia, New South Wales, and Northern Territory. The test will be voluntary. However, participation and feedback will help to ensure that the 2026 census captures the right information and is easy for people to complete and produces quality data. The data from the test is confidential, as with all ABS data collections. It'll be used by the ABS for testing purposes only, and it won't be released. The ABS also continues to engage with the EAC to progress work on how we engage with LGBTIQ+ populations to accurately answer the questions. Clarify how the data is collected and output, and how to manage people's privacy in environments such as group households. In terms of the experimental estimates, there's no plans to do another experimental estimates publication because we were capitalizing on a unique time where we had lots of population surveys in the field at the same time. So the census is what we are looking to now. So if people have questions, now would be a good time to ask them. I think Ian's going to relay the questions to us.
Yeah, so there have been a few questions that have been put into the comments. I wonder, oh, sorry, the chat. I wonder if people could put their questions into the Q&A. I have a couple of questions here. Somebody asked around to the question about if someone is aware that they have variations of sex characteristics. Is there an age restriction to that question?
So within the population surveys that we drew on for the experimental estimates, that question was asked of people who were 15 and over in some of the surveys and 16 and over in other surveys. And this is because we asked the question, that question of people directly. We didn't ask the parent of the child if they were 14 and younger.
There was a question also about how these surveys are distributed, and if the methods were similar to those of the census, whereby somebody would leave the survey at the household, and then whoever in the household would pick it up and then complete it, and then it was collected later.
Yeah, that's a fantastic question, and I don't think that I emphasized that enough. So these population surveys were done via an interview. So an interviewer would either go to a household, or in some cases they were done by video interview. And what happens is that the interviewer would pose the questions to the individual. They would say what answer, and the interviewer would record it during the interview. And this meant that we with these questions, they were right up front in the interview. So potentially before the interviewer and the respondent were able to establish a good relationship or a rapport with each other. And so that meant that that's another reason why people might not have felt as comfortable to disclose in a in the interview situation. So it's very different to the census situation, where a person might work through a form themselves. The other thing about having the interviewer in the room or online with somebody is that if the person had any questions about the what was being asked, if they didn't understand terms, then the interviewer was able to talk them through that, or explain the terms in the question. This doesn't necessarily always happen. Like if the person's not confident enough to say, they might just say, "Oh, I don't know," or just say no if they're not feeling confident to ask the interviewer, "I don't understand what this means." And I think that is potentially, I mean, it's the case for all of these questions, but I think it was particularly the case for the question on variation of sex characteristics, where in this in the interview situation, there was the opportunity for a person to ask, but we did see that a lot of people reported that they didn't know. And I think that could be a legitimate answer, but it also shows that some people didn't want to ask any more questions to find out. May have been that as well.
There's a question that asks if there were recordings of other gender diverse identities, such as gender queer, agenda, gender fluid, etc.
So people were able to write in gender, and gender fluid was a common term that people used. There were other terms that might have been used on a one or two off basis. But if people were writing terms in, we would still consider that their gender was not male or female. We just don't. There were so few for each one that we can't provide more detail about the numbers of each of those different options that people might have written for us.
And just a question about the upcoming census and preparations for that, so that the Australian public are ready. So are there plans for public education alongside or before the census to make clear why the new questions are being asked and how they'll be interpreted?
I'll tackle that one. We are working really closely with our LGBTIQ plus expert advisory committee for the 2026 census. We've been doing a lot of work on the topics themselves up until quite recently, and we're now turning our attention towards communications and guidance material and things like that. So that's definitely something that's on our radar, and we are actively engaging with the EAC for short to ensure that we can, explain things like even the nuance around how we can capture and output our trans and gender diverse counts and things like that we think is really important for people to understand if they can't see themselves in that two-step process. So that's a great question, but yes, we're working towards that.
Right. And a question on language. I mean, you engage with community groups in Australia to come up with the questions in the standard. When it comes to translating, offering the questionnaire in other languages, what's the process there? I think so. The question is, how have these questions been translated for languages other than English? Being really conscious that gender and sexuality terms and understandings of these really vary across cultures.
Go for it, Elise.
I was going to say, in terms of the population surveys, I will have to take on notice whether they were translated. But generally, what happens is that that's potentially somebody else in the household would translate at the time of the interview. There are other methods potentially that we would use. I'll throw to you, Nicole, in terms of the census side.
Yeah, so in terms of census, again, this is another part that sort of wraps into that communications piece that we're looking at. And this is something that has been raised, and we are very conscious of it, and we're looking to engage with the right people to ensure that we're using the appropriate language and that we understand what it is that we're asking and that we're asking people to provide information about. So yeah, we've also got some representatives on the EAC who we're hoping to be able to tap into their expertise and knowledge in that space too.
And the next question might present an opportunity to talk about the NHMRC statement that was released last year. But the question is, are the ABS proactive with engaging with major human research bodies around Australia for distributing these data and using the standards effectively?
That's a good question. We have tried to talk to our federal government colleagues about the release of this data to make it clear that we have released these experimental estimates. We have been in contact with the Australian Government Department of Health, the Australian Government Department of Social Services, the NHMRC. I'm not sure whether we've directly spoken to them. Nicole's nodding. Go for it, Nicole.
Yeah, we've engaged with the NMHRC, and obviously the result through a lot of work from LHA has been the recent statement that came out. We worked with them over a long period of time. We're also in connection with other agencies across the Commonwealth, but we're also in touch with the jurisdictions as well. There's a lot of jurisdictions who are really keen to implement the 2020 standard in their operational systems, for want of a better word. And we've been liaising with them to understand where they're at with it, any sticking points, and to provide guidance and advice in those spaces as well.
Well, thank you very much. Well, if no one has any further questions, we are a bit over time. So I'll thank you very much, Elise and Nicole. That was very interesting. Thanks for sharing your insights and for helping us understand how these data can better help drive policy and health outcomes for LGBTIQ+ people. Your work really enhances our knowledge, but also empowers us to advocate for additional resources for the health and well-being of LGBTIQ+ people. So thank you to everybody who joined us today. If you would like a copy of the slides, please email me. I left my email, put my email address in the chat. So thank you all who joined today. We appreciate your engagement, and we invite you to reach out via email for any further questions or for a copy of the slides. Just a reminder that there is support available at QLife, and their details are at qlife.org.au. We look forward to welcome you to our next webinar, which is in 2 weeks' time, which is titled Speaking Out at Work, LGBTQ Young People's Experiences of Sexual Harassment at Work. And that will be presented by Professor Kerry Robinson and Dr. Kristen Davis. So I'll see you then. Thank you again so much, Elise and Nicole, and thanks everybody. Take care.
Thank
Bye.
you all.
Thank you.